There are reasons why I chose a non-contact wide-angle viewing system for my retina practice. One, because I was already trained in a wide-angle non-contact lens system. I felt that would be most easy for me to use for my own practice. And the second point being, the cornea remains untouched during surgery, thus ensuring sterility and asepsis. And why I chose Volk SOLR is because of the high quality of lenses used and the ease of use with which it can be seamlessly integrated to any microscopes, and also the value that the Volk SOLR provides.
I've been using the Volk SOLR for the past 3 weeks. I've performed more than 50 vitrectomy surgeries with this system. The view has been quite excellent. The extent stereopsis we are able to achieve with this system. I've been operating all sorts of cases, diabetic vitrectomies with passionate detachments, giant retinal tags, or routine arachnoid retinal detachments, and even pediatric retinal detachment, as well as one case of retinopathy with the Aswin.
When I started my practice, I had tested the Volk SOLR on 3 different microscopes, and I'm happy to say that it integrated seamlessly with all 3 of them. The mount was also quite thick. For the wide-angle lens, it was very useful for retinal detachments where base shaving is crucial. For diabetic vitrectomies, again, the wide-angle lens was excellent for allowing me to reach the periphery for endolaser. The macular lens was very useful for macular surgeries and epiretinal membrane peelings because it gave a very clear, crisp view without compromising on the depth of vision also. When it comes to vitreous hemorrhage, floaters, as well as during PVD induction or any other step of surgery, the wide-angle lens, the macular lens play its part. The clarity of vision is quite crisp, the details are very clear, and the field of view that you get, both of these lenses are very good and comparable to other wide-angle viewing systems without compromising on quality or ease of use.
When I was operating this case of retinopathy of prematurity, first I was using the routine adult lens. I was filing a little bit difficulty because the optic was a little bit larger, the instruments were hitting it. But once I switched to the smaller pediatric lens from the SOLR system, it was very easy. The very small lens, it gives you a slightly more field than the wide field lens, and it's very easy to visualize the whole fundus in a retinopathy. It was a stage 4B case of retinopathy of prematurity. It gave an excellent view. Small lens doesn't hit your instruments. It creates a very small footprint so that it doesn't disturb your surgery. And the pediatric lens gives you a much more violent field compared even to the adult wide field lens. It gives an excellent view and a good experience when I operating the retinopathy of prematurity. It's always ideal to use non-contact system so that you can shift from posterior to anterior without any hassle. So non-contact system, especially SOLR system, is very useful when you're having a combined surgery. It can be a recently operated PECO, recently operated corneal tear, tear, or when you're removing intraocular foreign bodies, or when you're removing nucleus bit from the vitreous cavity, or in sterile fibers. All these situations, non-contact Volk SOLR system is better suited compared to the contact system.
Now, when comparing the Volk SOLR with other wide-angle viewing systems, the advantages that I felt were: 1, the ease of integrating with multiple microscopes. The second point being, the fine focus adjustment works excellent, and it does not need to be done even when you're switching between lenses, which is an added advantage. And last but not the least, the value. It is what you are able to achieve for that budget, especially for a startup retina practice like mine, was excellent. I have absolutely no regrets in purchasing the Volk SOLR.